It may be part patient lure, but some say medical mistakes spike and patient safety dips in July. That's when medical students become physicians and young doctors start their new jobs. From WHYY's Health and Science Desk, Taunya English visited Christiana Care's Virtual Education and Simulation Training Center. She found out how the teaching hospital puts new doctors through their paces before they see real patients.
If you're imagining that old board game Operation, where an unsteady hand gets you buzzed out of the game, think again. This training center has human-looking simulators and high-tech video games.
Doing these skills at expert levels, expert times and expert precision, will allow the surgeon to move into the operating room with excellent technique.
Newbie doctors spend hours perfecting fundamental surgery skills, performed through small keyhole incisions. When you need a delicate procedure like a bronchoscopy, it's nice if your doctor has had a little practice.
This is a graphic simulation, just like a video game. It simulates also the patient, so if I hit these vocal cords, you're going to hear the patient cough. All right, so I have to anesthetize those cords.
Dr. Kathleen McNicholas says the old mantra of medical education was see one, do one, teach one.
Medical students were not as actively engaged in doing it, and they did a lot of observing and learning through observation and learning through just gathering the information and role modeling other people. But when you get that big MD after your name, the first night you're on call, it's, doctor, what are you going to do?
The patient simulators aren't quite lifelike, but they complain, demand, even scream in pain.
Oh, I'm having contractions.
McNicholas says doctors suspend their disbelief so they can refine their skills in a safe environment.
We don't have to crash the airplane every time. We do the simulation that was in the aviation field has been moved very quickly into the field of medicine.
These new operating room nurses have chosen a high-stakes specialty that requires them to meticulously track their equipment and practice safe instrument handoffs.
Learning the instruments, how to set up a sterile field, what to have on the table, all makes you a better nurse.
Christiana's virtual hospital is outfitted like its real trauma suites, and JB the mannequin breathes, blinks his eyes, responds to medication, and is doctors.
Just because it's a mannequin, talk to it like it's a real person. That's the part, I think that's going to be the hard part for everyone. I think you get more out of it if you're like, hey Billy, what's up, you know, like you're going to talk to your actual patient.
Resident Elizabeth Lee says like a flight simulator, she can give her trainees a little turbulence, even make JB the mannequin stop breathing.
We can replay, we can practice. It was something you can't do on a live human being. Once you've harmed them, that harm's forever.
Taunya, it sounds like this would improve teamwork at the hospital.
The experts tell me that this kind of simulation training can really be helpful for junior members of the team. It helps them find their voice. Rookie doctors and nurses learn to speak up when they see something go wrong, because patient safety and preventing medical errors is everybody's responsibility.
And what are the costs involved?
I didn't get the full cost price tag for the entire virtual hospital, but JB the mannequin cost $250,000. Yeah, the center director says that the payoffs in patient safety are really subtle, but he thinks it's worth the investment.
And I've heard there are some concerns that at teaching hospitals, a certain time of year might not be as safe.
Right. They call it the July effect, and some people think that's fiction, but there's emerging evidence that there may be some truth to that. A new study from the University of California, San Diego, looked at death certificates and found that deaths from medication errors spike in July every year in counties where there are a lot of teaching hospitals.
Taunya English from WHYY's Health and Science Desk. Thanks so much.